How to treat and cure ear problems. Ear infections, also known as otitis media, are a common problem for infants and children, but they can occur in adults as well. Nearly 90% of children will have at least one ear infection by age 3. Infections can become quite painful because the buildup of fluids puts pressure on the eardrum. Many infections clear up on their own with home ear infection treatment, but more severe cases, or those that occur in younger children, may require prescription antibiotics to cure the ear infection completely. Identifying an ear infection. Image titled Cure an Ear Infection. Know who is most at risk for an ear infection. In general, children are more likely to get ear infections than adults. This is because the eustachian tubes are smaller in children and more prone to fill with fluid. Children also have weaker immune systems than adults and are also more prone to viral infections such as colds. Anything that blocks the eustachian tube can cause an ear infection. There are other risk factors for an ear infection, including allergies, respiratory infections such as colds and sinus infections, infection or trouble with the adenoids, tobacco smoke, excess mucus or saliva, such as that produced during teething. Living in a cold climate, changes in altitude or climate, not being breastfed as an infant, recent illness. Attending daycare, especially a larger daycare with many children. Recognize the symptoms of a middle ear infection. A middle ear infection, acute otitis media, is the most common type of ear infection and is caused by a virus or bacteria. The middle ear is the space just behind the eardrum that contains the small bones that pass vibrations to the inner ear. When the area becomes filled with fluid, bacteria and viruses can get in and cause an infection. An ear infection often occurs after a respiratory infection such as a cold, although severe allergies bring down cholesterol level with these simple methods. If you have high cholesterol, you're also at higher risk for heart disease. But the good news is, it's a risk you can control. You can lower your bad LDL cholesterol and raise your good HDL cholesterol. You just have to make some simple changes. I tell patients that you have to start somewhere and just keep going, says Suzanne Steinbaum, DO, an attending cardiologist at Lenox Hill Hospital in New York City. As you adopt lifestyle changes, everything starts shifting, and the improvements you see at 6 weeks often increase by 3 months. You still may need to take medicine to get your cholesterol back on track. But if you make just a few, small changes, you might be able to lower your dose and chance of side effects. Symptoms of a middle ear infection include ear pain or an earache, feeling of fullness in the ear, feeling ill, vomiting, diarrhea, hearing loss in the infected ear drainage. Fever, especially in children. Image titled Cure an Ear Infection. Distinguish between a middle ear infection and swimmer's ear. Swimmer's ear, also known as otitis externa or an external ear infection, is an infection of the outer ear canal caused by bacteria or fungi. Moisture is a common culprit for this type of infection, hence the name, but scratching or inserting things into the ear canal can also leave you prone to infection. Symptoms may begin as mild but often worsen, and include itching in your ear canal, redness inside the ear, discomfort that worsens if you pull or push on your outer ear drainage. More severe symptoms include feeling of fullness or blockage, decreased hearing, severe pain that radiates outward to your face or neck, swelling of neck lymph nodes, fever. Seeking medical attention. Image titled Cure an Ear Infection. Take your child to the doctor if he is younger than 6 months old. If you notice any symptoms of ear infection in an infant, take him or her to the doctor immediately. Infants at this age have not fully developed their immune systems. They are at a much higher risk for serious infections and will likely need immediate antibiotics. Do not try home remedies on infants and very young children. Always consult your pediatrician for the most appropriate route of care. Be prepared for the doctor to examine the eardrum more closely in case of a stubborn or chronic infection. If you or your child becomes quite ill as a result of ear issues, your doctor may make an opening in the eardrum and draw out a sample of fluid from the middle ear. She will then send these samples to a lab to have them tested. Treating ear infection pain at home. Take over-the-counter pain medication. Ibuprofen or acetaminophen can be taken if the pain does not diminish on its own or if other symptoms don't develop. These medications can also help reduce your child's fever and can make him or her feel better. Never give children under the age of 18 aspirin, as this has been linked to Reye's syndrome, which can result in brain damage and liver problems. Use child strength formulations when giving any pain reliever to children. Follow the dosing recommendations on the package or ask your pediatrician. Do not give ibuprofen to children under the age of 6 months. Apply a warm compress. A warm compress will help lessen the pain of an ear infection. You can use a warm, damp washcloth. You can also fill a clean tube sock with rice or beans and tie or sew the open end of the sock shut. Microwave the sock for 30 seconds at a time until it is the desired temperature. Apply the compress to the ear. You can also use salt as a natural remedy. Heat 1 cup of salt and place it in a cloth. Tie it up with a rubber band and place it on the affected ear for 5-10 minutes when it's bearably hot while lying down. Apply the warm compress for 15-20 minutes at a time. Get plenty of rest. Your body needs rest to recover from infections. Make sure that you do not push yourself too hard while you have an ear infection, particularly if you also have a fever. Pediatricians do not recommend that you keep a child home from school for an ear infection unless he has a fever. However, you should probably monitor your child's activity to make sure he gets the rest he needs. Stay hydrated. Particularly if a fever is present, you should drink extra fluids. The Institute of Medicine recommends that you drink at least 13 cups, 3 liters, of fluids daily if you are male, and at least 9 cups, 2.2 liters, of fluids daily if you are female. Try Valsalva's maneuver if no pain is present. The Valsalva's maneuver can be used to open up the eustachian tubes and relieve the stuffed-up feeling that may occur with an ear infection. You should only do this maneuver if you do not currently have ear pain. Take a deep breath and close your mouth. Pinch your nose shut. Then, while pinching the nose, blow your nose gently. Do not blow too hard, or you could damage your eardrum. You should feel your ears pop. Observing the condition. Monitor the ear condition carefully. Check your temperature or your child's temperature frequently and watch for other symptoms. If a fever develops or you observe flu-like symptoms such as nausea or vomiting, this can possibly mean the infection is getting worse and that home ear infection treatments are not working effectively. Symptoms that necessitate a trip to your doctor include confusion, neck stiffness, and swelling, pain, or redness around the ear. These symptoms indicate that the infection may have spread and that it needs immediate treatment. Notice if you feel severe ear pain followed by no pain at all. This could indicate the eardrum has ruptured. Ruptured eardrums can result in temporary loss of hearing. They can also make your ear more susceptible to infections, making the situation even worse. In addition to the absence of pain, there may also be drainage coming from the ear. Although ruptured eardrums usually heal within a couple weeks, even without treatment, some problems may persist that require medical intervention or treatment. Call your doctor if your pain worsens within 48 hours. While most doctors recommend a 48-hour wait-and-see approach, if you experience worsening pain during that period, call your doctor. Your doctor will be able to recommend more intense treatment or antibiotics. Get your hearing or your child's hearing tested if fluid buildup in the ear continues after 3 months. This may be coupled with significant hearing problems. Sometimes, a short-term hearing loss can occur, which is especially concerning for children 2 years and younger. If your child is younger than 2 and experiencing fluid buildup as well as hearing issues, your doctor may not wait 3 months to start treatment. Hearing problems at this age could affect your child's ability to speak and lead to other developmental problems.